chronic pain. It's just this huge challenge, isn't it? Affects so many people, often sticks around for years, long after you'd expect things to have healed. And if you're living with it or know someone who is, well, that search for relief can feel pretty relentless. Sometimes you look beyond the usual medical routes.
Definitely.
So what if something as basic as what you eat could actually be part of managing it? That's the connection we're really going to dig into today.
And it's a really timely topic. Our whole understanding of chronic pain has shifted.
How so?
Well, it's clear now it's not always about ongoing tissue damage. Often it's more about changes within the nervous system itself, changes that actually amplify the pain signals.
Right, amplifying them. Okay. So to get a handle on this, we've pulled together quite a few sources for this deep dive. We've got systematic reviews, those big studies that combine lots of research.
The heavy hitters.
Exactly. And papers looking right into the pain mechanisms, how it works in the body. Plus, there's a survey showing how people are actually using things like diet and supplements in the real world.
Yeah, what people are doing day to day.
Our mission here is to walk you through all this. We want to pull out the key insights, see what the research really says about diet and chronic pain, touch on the science behind why it might work,
And importantly,
and explore what it all means for you. We're aiming for clarity, without getting lost in all the jargon.
sounds good. So maybe first, let's just clarify what we mean by chronic pain based on these sources.
Yeah, you do.
It's basically pain that hangs around for longer than 3 months. So way past the normal time it takes for something to heal up. And like we touched on, a really critical piece that comes up again and again in these papers is that this involves actual sort of maladaptive changes in the nervous system.
Maladaptive, meaning not helpful changes.
Exactly. Changes in the neurons, how they connect, how they fire. It's like the system gets rewired, basically, becoming overly sensitive and just amplifying pain.
Okay, rewiring. And inflammation plays a role here.
A central role, many of these sources suggest. Persistent, low-grade inflammation. Specifically, they talk about neuroinflammation.
Neuroinflammation. So in the nerves.
Yeah, inflammation within the nervous system itself, and that's seen as a major driver of those nervous system changes that keep the chronic pain going.
Wow. So it's not just a side effect, it's actually like fueling the fire.
That seems to be the idea emerging from the research, yes.
Okay, let's unpack that connection then. How does food, what you eat, possibly link up with inflammation in your nerves and affect pain? It seems like a big leap.
Well, think about it on a biochemical level. One source talks about something called the arachidonic acid pathway.
Okay.
When you have an injury or irritation, this pathway kicks into gear. It starts producing these inflammatory mediators, things like prostaglandins and thromboxanes.
Right, I've heard of prostaglandins. Painkillers often target those.
Exactly. They're like little local alarm bells shouting inflammation, and they directly contribute to the feeling of pain. Now, here's the link to diet. The studies we're looking at focused on dietary parts, nutrients or food patterns that can actually modulate this process.
Modulate meaning,
Yeah.
influence it, change it.
Yeah, turn the volume up or down on those inflammatory signals. They also look at things that tackle oxidative stress, which is another process often linked with inflammation.
Okay, that makes sense. So certain foods might quiet down that inflammatory shouting match in the body.
That's the theory being explored, yes.
Got it. So if inflammation is key, and diet can influence inflammation, then it follows that diet could have a real role. So let's look at the evidence. You mentioned a systematic review. That sounds important.
Yeah, source one. It's a systematic review and meta-analysis, so it pools data from multiple studies to get a bigger picture.
What kind of studies did they look at?
They focused specifically on adults with chronic non-cancer musculoskeletal pain, so things like rheumatoid arthritis, fibromyalgia, osteoarthritis, back pain, nerve pain, that kind of thing.
Okay.
And importantly, they looked at interventions using whole food diets, not just single supplements. They also specifically excluded studies on headaches or pain from gut or reproductive issues, just to keep the focus clear.
Right. So the big question, what did they find? Did changing diet actually help these people with their pain?
Well, the main headline is pretty positive. They found an overall beneficial effect of these whole food dietary approaches on chronic pain.
Okay. That's encouraging. That's
Yeah.
really encouraging. Now, here's what I'm wondering. Did they find, the magic diet? Was there one specific way of eating that came out on top?
That's the fascinating part. No.
Really?
Yeah. The review found that no single diet was statistically better than the others they looked at.
So what kinds of diets did show benefits then?
It was quite a mix, actually. They included studies on Elimination diets, where you cut out suspect foods.
Like gluten or dairy.
Yes, exactly.
Yeah.
Also, vegetarian and vegan diets, diets that just focus on changing one thing, like boosting omega-3s, calorie-restricted diets, Mediterranean diets, a real variety.
Huh. So if no single one was best, what does that tell us?
It suggests, and this is a really key insight, that the benefit might be coming from the common ground between these different approaches.
Okay, like what?
Things like just improving the overall quality of the diet, making it more nutrient-dense. Sometimes weight loss was a factor too, which we know can help with certain types of pain, like osteoarthritis. These common factors likely work together to influence those pain pathways we talked about.
That makes a lot of sense. It's maybe less about the specific brand of diet and more about the overall shift. How did they measure the pain reduction? Was it significant?
They often use standard pain scales, like the Visual Analog Scale, the VAS score. And the review highlighted that in 17 different groups within the studies, people reported what's called a clinically objective improvement,
Meaning?
meaning the pain reduction was big enough to actually make a noticeable difference in someone's life, usually defined as like a 2-point drop or a 33% decrease on that scale. The combined analysis, the meta-analysis part, also confirmed a significant effect overall.
That sounds promising, but research always has caveats, right?
Absolutely. And the reviewers pointed this out clearly. Many of the included studies had limitations,
Such as?
things like lack of blinding, meaning people knew if they were getting the special diet or not, which can influence results. Also, problems with people dropping out of the studies or not always using the best statistical methods to account for those dropouts.
Right. So the results are encouraging, but we need more top quality research to be absolutely sure.
Exactly. Promising, but interpret with a bit of caution regarding the strength of the evidence for specific diets yet.
Okay. Let's touch on a couple of those specific approaches you mentioned. Elimination diets, how do they work? Just cutting things out.
Pretty much. You temporarily remove foods that you suspect might be causing problems, often common allergens or intolerances like gluten, dairy, maybe nightshades for some people.
And the review found studies where this helped.
It did. Some showed really dramatic results, actually. Looking at the details, one small study on dairy elimination reported get this, 100% pain reduction.
Wow. 100%.
Yeah. And another, using a personalized elimination plan, showed an 87% reduction. Now, these were smaller, maybe older studies, so you can't assume that's typical.
Sure, but still.
But it shows the potential power for some individuals if they identify a specific trigger food.
Definitely grabs your attention. What about vegetarian or vegan diets?
Those were also commonly studied and showed good results too. One study in the reviews table, for instance, found a 45% pain reduction with a raw vegetarian diet.
Interesting. And omega-3s. We hear so much about them for inflammation. How might they specifically help with pain, according to the sources?
Yeah, this is where the mechanism research gets quite detailed. Source 3 talks about specific compounds your body makes from omega-3s. Things with names like resolvins and protectin D1.
Resolvins? Like they resolve inflammation?
That's the idea. They're being studied because they seem to actively turn off the inflammatory process rather than just blocking it. And they seem to act on specific cells in the nervous system, like microglia immune cells in the brain, which are involved in that neuroinflammation we discussed.
So it's a much more targeted effect than just general anti-inflammation.
Potentially, yes. It's an active area of research. And the review also mentioned benefits from things like the Mediterranean diet. One study showed a 37% pain drop. Even studies on single foods, like blueberries or spearmint tea, were included, showing just how broad the research is becoming.
Okay, so that gives us a good picture of the clinical trial side. But what about the real world? You mentioned a survey.
Yes, source 4. This one looked at veterans with chronic pain and their use of what they called natural products, or NPs, so supplements, herbs, special diets.
And what did they find? Are people actually using these things?
Oh, absolutely. The use of NPs for pain was incredibly widespread in this group.
Yeah.
It's definitely not some niche thing. It's very common.
Okay. Any surprises?
Well, a key finding was that people often weren't just using one thing. They were frequently using multiple different NPs at the same time.
Multiple. Okay, that sounds complex.
It does. And maybe the most concerning finding was this. A significant chunk of people reported using these NPs as substitutes for their prescribed pain medications.
Instead of alongside them.
Yes, replacing them essentially.
Wow. That sounds risky.
It absolutely can be. And here's the real kicker, the big red flag from the survey. Even though many users admitted having safety concerns about these products, a huge proportion said they hadn't talked about using them with their doctors or healthcare providers.
Why is that so critical for you, the listener, to know?
Because these natural products aren't automatically safe just because they're natural. They can have side effects. They aren't regulated like medicine. So, what's on the label might not be what's in the bottle there. It could be contaminants.
Right.
And crucially, they can interact badly with prescription medications. This is especially dangerous if you have other health issues or you're taking multiple drugs already. The survey also noted people use them for related things like sleep problems, stress, anxiety, all common with chronic pain.
That really drives home the point, doesn't it? There's potential here with diet and maybe supplements, but going it alone, especially swapping out meds, is a big worry.
A huge worry. It really highlights that nutrition needs to be part of a bigger picture.
So not a magic bullet on its own.
Definitely not. The sources really reinforce this. Nutrition is a lifestyle factor, a piece of a larger puzzle. Chronic pain management works best with a broad approach, sometimes called biopsychosocial or multidisciplinary care.
Looking at the whole person, not just the pain point.
Exactly. And simply aiming for a balanced, healthy diet following general guidelines is valuable in itself. Plus, nutritional status like being significantly overweight or underweight is directly linked to worse outcomes in conditions like fibromyalgia and osteoarthritis.
So managing weight can be part of managing pain.
For many people, yes. And this is where having support comes in. Making lasting changes to how you eat is hard.
Tell me about it.
Right. So the sources emphasize the value of a multidisciplinary team, maybe involving dietitians, psychologists, occupational therapists to help with daily function, physios, people who can help address barriers and support that behavior change.
And getting professional advice on the diet itself seems key, especially for those elimination diets.
Absolutely crucial, particularly if you're cutting out whole food groups. You need personalized guidance from someone like a registered dietitian to make sure you're still getting all the nutrients you need and doing it safely, especially if you have other health conditions or take medications.
That feels like a really solid point to land on. We started by acknowledging how tough chronic pain is, and that search for answers. We've seen there's compelling evidence, like from that big review, suggesting whole food diets can make a positive difference. We've explored how, possibly through tackling inflammation, including that neuroinflammation.
And that various approaches might work, likely due to common factors like better diet quality.
Right. And then we saw the real-world picture, lots of people using natural products, but often without talking to their doctors, which carries real risks.
So the bottom line for you, thinking about all this, is that while diet looks promising for managing chronic pain, it needs careful thought. Making big changes or using supplements really should involve guidance from a professional, like a dietitian.
And talking to your doctor is essential.
It's non-negotiable.
Yeah.
Especially if you're thinking about adding supplements or, heaven forbid, replacing medications. That conversation with your whole healthcare team is just vital.
Definitely. Okay, so here's a final thought maybe for you to chew on, building on everything we've discussed. We know diet can influence these pain pathways. We know lots of people are trying natural approaches on their own. So the question is, how can we as individuals, as healthcare systems, as a society, better integrate the evidence-based nutritional strategies safely and effectively into standard chronic pain care? How do we make sure people get the right support and guidance?